Our chief medical correspondent, Dr. Jon LaPook, is with us to examine the threat posed by the virus. Good morning.
Good morning.
We want to have more about this, but tell us, how concerned is CDC that it will spread to the United States?
I spoke to Dr. Monroe yesterday, who's really an important person with this. He knows a lot about Ebola and other infectious diseases. He said, look, theoretically, it could come over here. Somebody could be incubating it, come over here, and it could become in the United States. However, this is not Africa. In America, we have very sophisticated modern infectious disease controls. There was an alert sent out to all healthcare workers around the United States a few days ago saying, be on the alert if somebody comes in with flu-like symptoms, think Ebola. So hopefully it's early identified and the person can be isolated, they track down their contacts, and it's much less of a situation of danger here than it is in Africa. In Africa, it's a totally different situation. I'm really quite concerned about it, that maybe we're starting to reach the tipping point in Africa where it's going to be harder and harder to get it under control.
Contain it.
Yes, absolutely.
And you have pointed out this incubation period and the concerns that people could be on a plane to the United States, have Ebola, and not even know about it.
Right.
But isn't it important to point out Ebola is not spread like the flu? It is spread through bodily fluids.
Yeah, I'm glad you're bringing this up because I'm feeling right now a real sense of panic starting to be around people in the United States. This is not spread through the air. It is spread through direct contact with body fluids. Yeah. It's hard to get it from person to person.
So you're not going to get it by sitting next to someone on a plane who has Ebola.
You are not going to get it that way. But in Africa, the problem is they don't trust the doctors. They're running away from the doctors. They're running away from the health clinics. And they don't have the same kind of infectious control procedures that we have here.
All right, Dr. LaPook, thank you so much.